नमस्कार, नमस्कार. गुड इव्हनिंग टू ऑल ऑफ यू. गुरुकुल आयुर्वेद महोत्सव मध्ये गुरुकुल आयुर्वेद महोत्सव में आप सभी का मैं वैद्य सपना वाघमारे हार्दिक हार्दिक स्वागत करती हूँ. इससे पहले कि ऑनलाइन वेबिनार को हम आगे बढ़ाए, हम गुरुकुल की एक वीडियो क्लिप देख लेते हैं. मैं एक वीडियो क्लिप प्ले करना चाहूंगी.
वैश्विक गुरुकुल परिवार महाराष्ट्र एक अद्वितीय व्हाट्सएप ग्रुप है. आयुर्वेद महर्षि पंचकर्म शिरोमणि आचार्य गुरुवर्य प्रतास जोशी नानाजी के आशीर्वाद से आयुर्वेद के प्रचार प्रसार एवं भारतीय चिकित्सा परंपरा के पुनरुत्थान हेतु एक समर्पित मंच के रूप में कार्यरत है. इस मंच की स्थापना हमारे प्रेरणा स्रोत गुरुवर्य कैलाशवासी वैद्य भरत कुमार जाधव जी मालेगांव इनकी दूरदर्शी दृष्टि, अथक सेवा और वैद्यों को एकत्रित करने की भावना से हुई थी. आज उनका नाम महाराष्ट्र ही नहीं पूरे भारत देश में संगठन, सेवा और आयुर्वेद प्रचार के प्रतीक के रूप में लिया जाता है. सच्चे आयुर्वेद को समझना और नए वैद्यों को सिखाना ही वैद्य भरत कुमार जी का प्रमुख उद्देश्य था. इसी कारण उन्होंने वैश्विक गुरुकुल के माध्यम से स्वयं लिखित 5 पुस्तकें प्रकाशित की. हमारे कार्य और उद्देश्य: गुरुकुल परंपरा के मूल्यों को पुनर्जीवित करने, जनरल प्रैक्टिस करने वाले वैद्यों को पुनः शुद्ध आयुर्वेद की ओर मोड़ने, नववैद्य पीढ़ी को सच्ची और गहन आयुर्वेद ज्ञान की ओर आकर्षित करने, समाज के अंतिम व्यक्ति तक आरोग्य और आत्मनिर्भरता पहुंचाने के कार्य में सक्रिय है. वैश्विक गुरुकुल एक व्हाट्सएप ग्रुप ऐसा भी है जो राष्ट्रीय स्तरीय अद्भुत आयुर्वेद कार्यों को निरंतर आगे बढ़ा रहा है. वैश्विक गुरुकुल परिवार द्वारा राष्ट्रीय स्तर पर विचार गोष्ठियां और संगोष्ठियां भी समय समय पर आयोजित किए गए हैं, जैसे श्री गुरु स्मरण, रुधिराग्नि, वैद्य भरत कुमार आयुर्वेद सेवा महोत्सव, विशेष आरोग्य कैंप्स एवं व्याख्यानमालाएं, फ्री ऑनलाइन आयुर्वेदा वेबिनार्स. इसके बाद गुरुकुल औषधि भंडार की स्थापना हुई, जहां शास्त्रों और ग्रंथों में वर्णित पद्धति से तैयार की गई औषधियां, सभी प्रकार के सिद्ध घृत, तैल, शतावरी कल्प, विशेष रूप से बस्तांड घृत, मज्जा तैल, वजेड़ी घृत, अस्थि मज्जा पाचक घृत जैसी औषधियां गुरुकुल औषधि भंडार के माध्यम से वैद्यों को अत्यंत प्रभावी रूप से वितरित की जा रही हैं. हमारे गौरव पुरस्कार: हम हर वर्ष आयुर्वेद क्षेत्र में अतुलनीय योगदान हेतु 2 विशिष्ट राष्ट्रीय पुरस्कार प्रदान करते हैं. राष्ट्रीय आयुर्वेद रत्न पुरस्कार आयुर्वेद क्षेत्र में उत्कृष्ट योगदान हेतु, राष्ट्रीय रणरांगिणी पुरस्कार स्त्री आयुर्वेद वैद्यों के समर्पित कार्य हेतु. 19 मार्च 2021 को हमारे वैश्विक गुरुकुल परिवार के प्रमुख आयुर्वेद व अध्यात्म के गहन अभ्यासक वैद्य भरत कुमार जाधव जी का दुखद निधन हुआ. धन से ज्यादा सेवा को महत्व देने वाले भरत कुमार जी गुरुकुल को ऊंचाइयों तक ले जाना चाहते थे. वे अपने लिखे हुए विचारों और योजनाओं से ये सपना साकार करना चाहते थे, लेकिन नियति को कुछ और ही मंजूर था. आज भी वैश्विक गुरुकुल की टीम उनका सपना साकार करने में जुटी है. उन्हें दिल से सलाम.
अभी मैं आयुर्वेद के देवता भगवान धन्वंतरी जी को नमन करते हुए आगे जाऊंगी. आज के हमारे जो प्रमुख वक्ता है वैद्य राहुल शेरखानी सर, MS आयुर्वेद शल्य तंत्र. सर का परिचय देने के लिए मैं वैद्य जिरोनकर सर को आमंत्रित करना चाहूंगी. सर प्लीज.
नमस्ते. भगवान धन्वंतरी को नमन करके गुरुवर्य नानाजी की नमन करके आज का ये जो सेशन है उसकी शुरुआत करते हैं. आज के जो स्पीकर है डॉक्टर राहुल शेरखानी सर. It's my immense honor and privilege to introduce a truly distinguished personality in the field of Ayurveda, Dr. Shirkhani sir. Sir is MS in Ayurveda and PhD. Sherkhani sir is currently serving as a professor and head of the Department of Shalya Tantra at the prestigious Faculty of Ayurveda, Institute of Medical Sciences, BHU, Varanasi. One of the best institute in our India, and renowned for its curriculum and all these things, inventions. Over the 15 years of rich teaching experience, Dr. Sherkhani sir has guided numerous postgraduate and doctoral scholars. Sir has supervised 8 MS theses, 1 PhD, and co-supervised 25 others. Sir has an impressive academic and professional journey, having served in leading Ayurvedic institutes across India, including All India Institute of Ayurveda, New Delhi, Institute of Ayurveda, BHU, like this. Sir is a very prolific researcher and academician with 40 plus research articles. Sir has published more than 40 research articles in Sharle. Sir has published 3 books, and uh, he has organized or leaders in 100 plus academic programs, including webinars, conferences, faculty development initiatives like that. He has not only contributed to academic excellence but also played a key role in shaping Ayurvedic surgical education and advancing Shalya Tantra through research and practices. Sir has developed a new technique. Sir will explain in his session. Please join me extending a warm welcome to Dr. Rahul Sherkhan, sir. We are really honored to have you with us, sir, today. Please start, sir.
Thank you, sir. Thank you for such a nice introduction. Actually, I apologize for the technical difficulties at my end. So,
It's okay,
can
sir.
someone can play the PowerPoint presentation PPT?
Yes. Sapna ma'am or Anuj, please start PPT on this end, because सर के वहाँ पे भी लाइट का इशू है करंटली. सो हमको यहाँ से पीपीटी शुरू करना पड़ेगा. सर विल डिस्क्राइब और सर जैसा बोलेंगे नेक्स्ट तो नेक्स्ट करना है. प्लीज. We are really lucky to have a sir with us. Sir has developed various dimensions. He has developed new techniques in Shalya Tantra. I'm lucky that I have listened sir in past. Yes, sir.
Uh, thank you, sir. And it's my privilege to speak to you today from the sacred grounds of Banaras Hindu University. We all gather here to explore the genius of Achar Shushruta, who lived and taught in Varanasi, the spiritual and scholarly heart of India. Today's journey is through Shalya Tantra, an ancient surgical science that still echoes in the operating theaters of modern medicine. एक्चुअली सर टॉपिक मुझे समझ में नहीं आया कि शल्य और आयुर्वेद ये इतना वास्ट टॉपिक है. तो मुझे इनिशियली लगा था कि ये लेमैन्स के लिए वगैरह प्लान होगा, लेकिन ये सब आयुर्वेद के ही है. तो ये लिटिल बिट मोर देन थेरापेटिक टॉपिक हो गया है. नेक्स्ट टाइम वी विल मोर प्रैक्टिकल एस्पेक्ट्स पे ये करेंगे सर, लेकिन हम चाहते थे कि किसी तरह से शुरुआत हो जाए सर. सो
Yes, sir.
लेट्स बिगिन. नेक्स्ट स्लाइड. Next slide, please. Shushruta. Who was the Shushruta? First, previous slides, ma'am. So, who was Shushruta? Shushruta was not just a surgeon. He was a philosopher, anatomist, and teacher, practicing in ancient Kasi. His holistic understanding of the human body and its elements marked him as a father of surgery. He saw surgery not a mechanical craft, but a sacred responsibility demanding precision, ethics, and compensation. Next slide, please, ma'am. As all of you are aware that Ayurveda Avtaran, Lord Dhanvantari was the stands to be divine power and physician and guardian of healing sciences. The names beneath him are Opadane, Vaitaran, or therapeutic practice. Thus, the classical Indian medicine is not merely treatment; it is dharma, wisdom, and devotion of which are interlinked to each other. Next slide, ma'am. Uh, there are four stratas. Original Shushrut Samhita is layered into four strata. Vruddha Shushrut, he is the wiser elder who originally wrote the Shushrut Samhita. Then the Shushruta is the primary compiler. Nagarjuna, who refined the teachings in the Shushruta Samhita, and the Chandrat, who added commentaries, and this collaborative evaluation ensured preservation and refinement, much like peer-reviewed journals today. Next slide, please. Magnitude of Shushruta Samhita, this is not an ordinary manuscript. It comprises 184 chapters. Next slide, ma'am. Documentation of thousand, 1,120 diseases, identification of 700 medicinal plants, 67 preparations from the mineral sources, and 57 preparations based on animal models. Each line pulses with centuries of observation and experimentation, making it one of the most comprehensive surgical treatises of ancient science. Next slide, ma'am. So globally, from Sushrut Samhita is translated from Arabic to Greek, Greek to Persian, Persian to and English. Sushruta's teaching crossed the borders at the times. His methods influenced the medieval Islamic surgery and referenced in the European anatomical text. This is the impact of timeless science, and it flows beyond the language and geography at that time. Next slide, ma'am. Varanasi and was the disciple of Devadas Dhanvantari. He taught in a renowned medical school that is promoted Ayurveda as a complete system, including surgery. For Shushruta, a physician was more than a healer, he was a teacher and an ethical guide. His work laid the foundation of structured surgical training and practices. Next slide, ma'am. So, what are the contribution of Shushruta to surgery? Just I'm ourselves limiting to the surgery. So we progress deeper into the Shushruta surgical legacy. It is essential to recognize not just what was written centuries ago, but how modern science has embraced it. This slide is contributed to how the contemporary journals across the disciplines acknowledge his brilliance. Take a look. This is the Indian Journal of Plastic Surgery, calls him our proud heritage, emphasizing previous slide, ma'am. Our proud heritage, emphasizing the performed rhinoplasty and reconstructive procedures over the millennium before the Hippocrates. In the internal journey of plastic surgery, Dr. Sanjay Saraf refers him as a first plastic surgeon in 600 BC, a title once debated, now widely accepted that the Sushruta was the first plastic surgeon globally. Even a pediatric surgery finds echoes of his wisdom. A publication in the Journal of Pediatric Surgery explores how Sushruta understood the congenital intestinal anomalies like His disease long before they were named. In ophthalmology, documented ophthalmology honors him as a father of Indian ophthalmology, acknowledged his early cataract surgery techniques. From urology journals to surgical reviews, Shishruta's name is not confined to the Indian text. It resonates the peer-reviewed publications worldwide. His contributions are not just historically significant, they are significantly validated. This convergence of ancient wisdom and modern scholarships is not a coincidence, it's an acknowledgement. This journal serves a bridge between the Ayurveda and global biomedicine, between resurgence and recognition. Next slide, please, ma'am. Introducing the legendary Sushrut Samhita, an ancient surgical text that laid the foundation of medical science. From cataract surgery to reconstructive techniques, Sushruta pioneered procedures long before the modern medicine, and this scrolls is not just a relic, it's a blueprint of surgical excellence centuries ahead of its time. Next slide, please, ma'am. Sushruta described before the scalpel touches the screen, the wisdom of Sushruta guided the meticulous preparation from patient selection to anesthesia protocols. Preoperative rituals including fasting, tool readiness, and even wine as anesthetic, and ancient science meeting surgical precision. As a verse from the Sushruta Samhita reminds us, every step must be taken with reverence and responsibility. Next slide, ma'am. Uh, Sushruta described 121 types of the surgical instrument in a poetic Sanskrit, each classified by name, shape, and resemblance to nature, such as Mandalagra, Nakashastra, Dwapi Mukha. These nomenclatures are intuitive, drawing parallels from the animals like lions and parrots. These instruments were not just tools, they were extensions of the surgeon's intent. And next slide, please, ma'am. And it is probably the first surgeon in the world to classify and describe surgical instruments in detail. Two full chapters of the Sushruta Samhita were devoted in detail, described to 121 types of surgical instrument. Next slide, please, ma'am. Next slide. Next slide, please, ma'am. He not only describes the instruments and divided, but he also one previous slide, ma'am, please. He not only described the instrument, but he used the methodology and what are the applications of that instrument. He said that it can be used for the diagnostic and therapeutic purposes. Diagnostic purposes such as rog darshanarth, therapeutic purposes shrotogat shalyoddharnarth, achushanarth, and helpful in different procedures such as today's endoscopes are the excellent examples of instruments for diagnostic and therapeutic aid. Next slide, please, ma'am. He described the sharp instrument for the blind procedures, such as evaluation of instruments used in the blind surgical procedures, such as sharp instruments were carefully designed as they have to be safe to avoid undesired tissue damage. Sushruta used sharp instrument for blind procedures like segmenting the dead fetuses in the uterus and throat abscesses, various instruments he described. Next slide, with ma'am. Sushruta described one of the instrument that is called as ARA. Purpose of ARA described in Samhita is to check whether the abscess is ripe or unripe. Amavastha hai ya pakwa avastha hai. That is, we can correlate this as a diagnostic procedure. Tissue biopsy may be originated from the concept of this ARA, needle, biopsy needle. Next slide, please, ma'am. These are some of the newer instruments which are resembling that the swastik yantras. All are the basics of swastik yantras. This is the Cheetle's forceps, artery forceps, towel clips, sponge holding. Any crisscross cruciform instruments are included under the swastik yantra. Next, ma'am. Not only he described the instruments, types, uses, he also described how instruments should be prepared and what material should be used for the preparation of the instrument. And he said that the instrument should be prepared from the best quality of iron. Iron means different types of the metals. Along with that, he asked to use different types of woods, hasti, dant, godant, that are other methods described for uh, preparation of the instruments. Next slide, ma'am. He beautifully classified, meticulously separated blunt and sharp instruments. Swastik yantra are 24, sadhan shantra, 22 kinds, tal, nadi, shalaka, upayantra. Even the instructions for sourcing the skills backsmiths were laid out. Precision started with craftsmanship. Next slide, please, ma'am. These are the some of the pictures of old instruments and diagrammatically are available right now. Next slide, ma'am. Uh, he described 20 sharp instrument. Next slide, man. Next slide, man. Next slide, ma'am. Next, next, next. This is just and all this one slide back, man. Previous slide. This is not an end. He's described. He said that you can design the instrument, new instrument, according to your need, according to your purpose, and there are n number of instruments you can design yourself as per your need. Next slide. Remarkably, next slide, Sushruta conceptualized the sepsis centuries before the germ therapy. He advocated fumigation using herbs, sterilization with red hot instruments, normal natural disinfections like madhu and ghee, such as practices mirror modern antiseptic principles. Next slide, please, man. These are the few of the references that suggest that there are description of the infectious diseases in the Samhita. Next slide, ma'am. So, while treating the discharge from the fistula, Sushruta has indicated to burn the fistula's tract with red hot instrument. Concept behind the red hot instrumentation is not only for the cautery but mut baby for the sterilization. In reference to the treatment of Agantush Bhagantara, application of creamy Nashak drugs is advised after withdrawal of Shalya. Withdrawal of foreign body particles from the fistula's tract clarifies that the microbial concept in those days were well known to Sushruta. Next slide, Vidman. There are few other papers published that if the extremity, whether it is upper or lower, is excised, and it is advised to burn it with the hot oil and proper bandages should be done. Sushruta has described its treatment by ligating the omentum with thread, and after pouring some kashai bhasmas, described he, and it should be excised by red hot instrument, applying the coat of honey over it. Honey and ghee were naturally available disinfectant present in those days, more probable to keep the area devoid of the microorganism, and they may use these products to prevent sepsis. These are the some of the initial references, and which suggest that the concept of the infection and microorganisms are very well known to Shishruta. Next slide, please, ma'am. Next slide. Anesthesia, no chloroform, no ether, but Shushruta had a wine. He wrote, Madhyam Tikshnanam Piyayat, administered the potent liquor to reduce the pain. Though primitive, it worked, and preoperative feeding and sedation strategically anticipated modern anesthesia in a spirit and intent. Uh, exactly general anesthetics are not mentioned, but there are vivid references regarding the concept of the anesthesia and sedations are available in the Shushruta Samhita. Next slide, please, ma'am. Operative measures, Sushruta outlined 8 core. Next slide. surgical techniques ranging from the incision to suturing. Specific surgeries like cataract removal, cesarean section, exploration, laparotomies were codified in anatomical detail. 8 basic surgical procedures, all the types of surgical maneuvers. The types of disease amenable to each maneuver and technique have been given in detail. More than one technique could be used according to the necessity. Besides this, some specific procedures are described at the various places, such as different types of the grafts, perineal, vesiculottomy, urethral dilation, cesarean section, removal of cataract, techniques of excellotomy are well described in Shushruta Samhita. Next slide, please. Shushrutas, these all type that these are the Ashtvid Shastrakarmas, all ectomies, ostomies, oscopies, ostomies, all comes under these 8 basic surgical procedures. आजकल जितना भी है, जितने प्रोसीजर्स हम कर रहे हैं, ये इसी 8 के अंदर में सब कुछ इंक्लूड हो जाता है. नेक्स्ट स्लाइड प्लीज मैम. There are basic principles. Shushruta Samhita are basically written for the surgeons. So the first Sushruta's surgical fineness began with the incision, precisely positioned, deliberately shaped, and always mindful of vital anatomy. His works guided surgeons to make ideal cuts, strategic counter incisions, and extensions that preserved life and minimized harm. Even today, his teachings echoes through the scalpel, where intention meets anatomical wisdom. Next slide, ma'am. Sushruta's Sushruta's incisions were not arbitrary, they were anatomically mindful, varying by the region from forehead to groin with precision and purpose. Mistimed and misaligned cuts risked the nerve damage, chronic pain, delayed healing, and even severe abscesses. Warnings echoed in the ancient verses. These teachings remind us the scalpel must be guided not just by the hands, but by deep anatomical wisdom and reverence for the life. Next slide, please. Next slide. Long before the synthetic threads, Sushruta stitched the wounds with the silk, plant fibers, tendon strands, and even live ants as a natural clamps. Using ant heads to clip wounds was not the myth, it was the genius, blending biology with surgical innovations. Each material reflects a time when nature was the pharmacy and ingenuity was the tool set. Next slide, please. Sushruta revolutionized the wound closer with specialized needles, each set for the purpose, round for the gentle tissues and triangular for the cutting cord for the incision. These were not just tools, they were anatomical innovations crafted centuries ahead of their times. Every cord and rage reflected his mantra, and this technique must honor the body's natural pathways. Next slide, please. Sushruta did not just innovate the materials. He mastered the techniques. Detailed suturings like Gofunika, Vellitak, Rujugranthi, Tunnashevani for different anatomical needs. These methods, blanket, continuous, interrupted, and subculture, reveals a surgeon's mind tuned to tissue healing and wound integrity. Sushruta recognized blood. Next slide, please. Shushruta recognized the blood as a root of a life. Loss must be halted instantly to preserve the vitality. When depletion exceeds the life limits, replenishment it's optional. It's a life saving. Even advised via transfusion like remedies. And for the healing, proper nutrition was essential. He prescribed strengthening diets to restore the patient from deep fatigue and wound drainage. Next slide, please. Sushruta recognized centuries before the modern medicine. Sushruta described intubation, nasogastric feeding, and even healing of intestinal fissulas with anatomical insight. He advised tube feeding through the lotus stalks and hot metal intubations for airway obstruction, precise method rooted in the human physiology. This verse shows the thoughtful intervention, not just a technique, is the true essence of surgical wisdom. Next slide, please. From bladder stone to sexual dysfunction, Sushruta described urological disorders with anatomical precision. Centuries before the modern medicine, he pioneered methods like lithotomy, positioning, stone mobilization, and extraction alongside the clear post-operative guidelines. His legacy is not just a technique, it's treating human sufferings with scientific clarity and surgical and compassion. Next slide. Next slide, please. Sushruta tackled bladder stones with both holistic remedies and bold surgical precision. Next, just before previous slide, ma'am. Sushruta tackled bladder stones with both holistic remedies and bold surgical precisions, ushering the technique centuries ahead of its time. His perineal vesicolithotomy combined the pre-op alkali treatments, manual lithotomies, post-op care like fermentation, cauterization. Even without modern tools, he understands the anatomy, pain, and healing like surgeon guided by the science and soul. Next slide, please. In the era of in an era without anesthesia or modern imaging, Sushruta detailed urethral stone removal using incisions and tools like barbed hooks with a surgical precision. He described urethral relations with lotus-like talks, nourishment post-procedure. His urending techniques with heating and testament to a surgery as both science and art. Next slide, please. He also described from scrotal surgery to paraphymosis reduction, his hands-on methods were centuries ahead. Using lotus stalks and rice grain incisions, he treated the genitourinary systems with elegant precision and anatomical mastery. His approaches understand deeply, act boldly, and heal completely long before surgery became a science. It was his art. Art. Next slide, please, ma'am. Long before the modern reconstructive surgical techniques, Sushruta described the rotation and pedicle grafts. Next slide, please, ma'am. And without stunning anatomical clarity, using live tissue transfers and layered incisions, he performed repairs that mirrors today's flap surgeries without a luxury of modern tools. His legacy proves that what observations meets intuition, surgical innovations finds its true origin. He mentioned various grafting methods such as rotation graft, pedicle graft, etc. Pedicle grafts is an example of Gandotpatta Maunshena Sanubandhena Jivita. Rotational graft, Ekevatu Bhavet Palim Sthula Prathva. These are some of the references described available in the 16th chapter of Sushrut Sutrasthana. Next slide, please. Sushruta Samhita provides one of the earliest known accounts of the tissue reconstruction, outlining techniques analogs to modern flap rotation grafting. His procedural descriptions, including parallel incisions, layered closures, and tissue mobilization, demonstrates the detailed anatomical and surgical understanding of reconstructive principles. Such interventions underscores an advanced grasp of both form and function, emphasizing that surgical repair was not only a technical but deeply restorative to intent. Next slide, with ma'am. Sushruta emphasized that the grafting must never be performed on impure, excessively bleeding, and depleted vascular blades. The verse from Sushruta Samhita reveals his awareness of tissue perfusion and its role in healing outcome. He acknowledged the importance of healthy circulation for flap survival, a concept central to the modern plastic surgery. This reflects not only anatomical insights but early principles of surgical physiology. In every surgical repair, Sushruta prioritized both structural success and biological viability. Next slide, please, ma'am. He described various operative reconstructive procedures such as mutilated nose, rhinoplasty, earlobes, otoplasty, cleft lip, grafting the healthy skin from the cheek, rotation of the pedicle flap, and reconstruction, etc. Next slide, please, ma'am. The classical cheek flap rhinoplasty of Sushruta was later modified by using a rotation flap from the adjacent forehead. Actually, classically, this flap, rhinoplasty, is described that a flap should be taken from the cheek, but at present, what we are, plastic surgeons practicing, they take a flap from the forehead. Next slide, please. A nasal repair or rhinoplasty has been described in greater detail. Then the repair of the cleft lip too has been mentioned. In short, all the principles of plastic surgery, accuracy, precision, and economy, accurate cutting, suturing of the flap to the nose, maintenance of airway with tubes, hemostasis, and perfection finds an important place in Sushruta writing on the subject. These are the classical picture of what Sushruta described. But right now, in present day, rhinoplasty, their forehead flaps are used, which is a replica of cheek flap. Next slide, please, ma'am. So we should, he knows well about सानु बंधेन जीविता. अगर हम अपने प्रीवियस, अपने बंध से, अपने पैरेंट टिश्यू से अगर हम अटैच है, तब हम जीवित रह सकते हैं. दैट्स द थ्रू कंटिन्यूटी वी सर्वाइव. सो द फ्लैप सर्वाइव्स. हम फ्लैप को उसके ब्लड सप्लाई के साथ जब ट्रांसफर करेंगे तो वो सर्वाइव करेगा. दिस इज द ब्यूटीफुल fundamental principle described by Sushruta, and it is valid. It is greatly valid today. Next slide, please. Orthopedic surgery. Orthopedic techniques ranged from the fracture classification, dislocation, management of rehabilitation, malunion corrections, specialized devices like fracture bed, Kapat Shayan Vidhi demonstrate its holistic approaches. History of trauma is the earliest references finds in this Shushruta Samhita. And he was the first to describe the classification, and he was the first to describe the skeletal injuries. He was first to describe the basic principles of orthopedics. Next slide, please. Next slide, please. The principle reduction, retention, rehabilitation, Anchan, Pedan, and Sankshep, that are the reduction, retention, and manipulation. These are the basic principles of bone setting that are well described centuries before. The current modern science is well described, and at present these are still valid. That are all the principles are still valid. Next slide, please. And beauty of the Sushrutam orthopedics is not only in the manipulating the bones and setting the bones, but he also described the rehabilitative procedures to, which is the part of a physiotherapy right today's days. He had also devised the Kapat Shayan Vidhi, fracture bed, etc. Next slide, please. And malunion fracture, treatment of the malunion fracture, and description of ideally united fractures were also described in the Sushruta Samhita. Next slide, please. Next, please. Sushruta's teaching led foundational principles for abdominal surgeries in cases like volvulus, herniation, and GI perforation. Texts such as Sushruta Samhita, Sutrasthan, Chikitsasthan emphasizes anatomical localization, stepwise management of intestinal crisis. He described laparotomy, Bhinna coast techniques that parallel modern exploratory procedures for acute abdomen. In obstructive pathology, but though the precision in decompression and bowel handling was crucial, his approach merged surgical skills with a systematic understanding, underscoring the role of vascular integrity and tissue balance. This Sanskrit verses reflects timeless clinical wisdom rooted in observations and anatomical mastery of Sushruta. These are some of the references available in the Chikitsasthan where we can vividly correlate with the exploratory laparotomy, interception, GI perforation, intestinal obstructions. Next slide, please, ma'am. Sushruta outlined clear interventions for critical abdominal conditions, including peritonitis and GI bleeding. He described peritoneal lavage with medicated fluids such as emphasizing contamination control. GI bleeding managed with involved recognition of hematemesis. Detailed descriptions are available in the Chikitsasthan. For ascites, Udar, Sushruta guided precise paracentesis noting depth, site, and catheter choice. His approach unified anatomical expertise, therapeutic clarity, and procedural safety. These versions stands as a early templates for evidence-based and abdominal surgery. Next slide, please, ma'am. The first sign wounds, most of the Shushruta Samhita are described for the wounds. More than 12 chapters are devoted, Shushruta Samhita's 12 chapters devoted for the wound management. So the first scientific definition of the wound, जो आज तक भी कोई भी साइंस में बनी नहीं, ऐसी डेफिनेशन फर्स्ट वुंड की सुश्रुत संहिता में अवेलेबल है. वुंड्स एंड देयर मैनेजमेंट्स अवेलेबल है, सर्जिकल प्रोसीजर्स अवेलेबल है मैनेजमेंट के लिए. दिस इज द एनसाइक्लोपीडिक and leave no room for any unaddressed aspects on wound healing. Next slide, please. He etiologically classified wounds into sharirik, that is internal wounds called as ulcers, maybe loosely ulcers, and agantujuan external causes. The stages, next slide, please. The clinical stages, first time description of the clinical stages are available. Next slide, please. In the Shushruta Samhita, that is Dusht Vran. Next, please. Next, please. First clinical classification, first time description of the clinical classification, such as Dusht Vran, Shuddha Vran, Ruhyaman Vran, Rude Vran, and managements. These are the first clinical classification, long centuries before the सेल्सियस who described रूबर कलर डॉलर कलर. इसके बहुत साल पहले सुश्रुत ने उसके क्लिनिकल स्टेजिंग, उसके इन्फ्लेमेशन के साइन सिम्टम्स डिस्क्राइब की है सुश्रुत संहिता में. नेक्स्ट स्लाइड प्लीज. A management of general conditions, providing a clear environment by Vranita agar, Dhupan Dravyas, medicinal drugs, and 60 measures for the wound management are also available for management of the wound. Remarkably unchanged today, even these are remarkably unchanged. Next slide, please. Next slide, please. These are the traumatic wounds. Till it is the same classification we use in the modern medicine also. Burns. Sushruta described accidental burns into 4 according to their degree and tissue. The resemblance still till today, it is a very valid classification, and based on these 4 stages, presently 6 stages are categorized burns into 6 stages. Heat stroke, along with heat stroke, sunstroke, injuries to the lighting, etc. This classification underlines his view on all the thermogenic trauma, whether due to extreme cold or heat, either wet or dry, chemical or inert fluid, produces damage and almost similar, hence has to be managed as a one entity. The value of Shushruta's classification could be realized from the fact that this concept gained validity in modern surgery only recently after 1950s, and now uniformly accepted its classification and management of these injuries. Next slide, please. These are the classifications of the burn described in the Shushruta, Snigdha, Dravam, and Agnitaptav. These are the frost blight. Next slide, please. Next. Anorectal disorders, you are all aware that the Sushruta's expertise extended to the fistulae and hemorrhoids, rectal prolapse strictures. He introduced incisional techniques named Langalak, Sarvotro, Bhadra, Chandratak, Kharjur, Patrak. These are the various types of the incisions described for the management of the Bagandars, and even today we practice all these incisions in our center. Next slide, please. I think one of his most unappreciated contribution lies in the vascular surgery. One of the paper published that the father of vascular surgery is Sushruta. He wrote on the ligation and hemorrhage control using compression, approximation of the cutting edges, cauterization, thermal or chemical, static decoctions. Modern vascular surgery owes its primal steps to these interventions. Even in a history of vascular surgery by Stephen Friedman, Sushruta earns rightful recognition. Next slide, please. Next slide, please. Bandaging was one of the most basic requirement for the surgeon. and it was the bandaging was the treated not as a routine but as a art. Sushruta described 14 types. Next slide, please. 14 types of bandages from swastik, gofna to vitana, each tailored to the body counters, and he emphasized the choice of a material, bandaging frequency, seasonal and age-based variation. His holistic wound protection approaches combined science and personalization long before the modern dressings evolved. Next slide, ma'am. Next, please. Biosurgery is a newer concept. When antibiotics failed to reach, Sushruta employed nature. He prescribed medicinal leeches for the venous congestion. He advised salvage of vascularity compromised flaps, muscle, skin, and fat tissue surgically removed from one part of a body to another, or salvage of vascularity compromised replants. Nowadays, we are plastic surgeons are commonly uses leeches for to increase the viability of flaps or graft. Next slide, please. Maggot therapy using fly larvae for the necrotic debridement. These creatures were tools, not threads, capable of saving the limbs and leaves. They are now validated in surgical journals, wound care research today. Next slide, please. These are basically maggot therapies are basically indicated for neuropathic foot ulcers, non-healing traumatic post-surgical infected wounds, pressure ulcers, venous ulcers, etc. Next slide, please. Sushruta is not only great surgeon, but it is a great teacher. He described the practical training, and it was the first surgeon to evolve the sound methods of training to his students in a surgical screen. Experimental operative surgery for achieving perfection in a various surgical procedures, parasurgical procedures, and bandaging, etc. Incision and excisions are advised on vegetables and leather bags filled with a mud. Scraping is advised on hairy skin of animals, puncturing on veins of the dead animals and lotus stalks, probing moth-eaten wood, ironed bombies, scarification wooden planks, and smeared with a beeswax. Next slide, please. To train a surgeon, Sushruta believed in two things: deep theoretical understanding and hands-on practical simulations. Cadaveric dissections were sacred and methodological, carried out on preserved bodies. Next slide, please. Sushruta, as a physician, according to the Sushruta, everybody must wisely read, engaged in debate, and trained under experienced masters. Learning was not a linear, it was an interdisciplinary. He advocated understanding allied branches like toxicology, pediatrics, internal medicine, etc., to ensure the comprehensive care. Ma'am, next, previous slide. All the participants, I have shared my PPT, and ma'am, you shared all these PPT with all the participants, ma'am. Some participants are asking for the references of maggot therapy, so you may share with them, ma'am. Okay, ma'am. Next slide, with ma'am. Code of conduct, allied science knowledge. Next, ma'am. Code of conduct. No science thrives without ethics. Sushruta laid down an extraordinary moral framework. Physicians should be clean, honest, and respectful. No exploitation or favoritism. No romantic or emotional engagement with the patient, such guidelines preserve the sanctity of patient-doctor relationships and elevated medicine to a noble pursuit. Ma'am, next slide, please. Post-operative care, he also described the surgery was only half the story. Healing was the another half story. He directed specific diet plans, sleep, hygiene, dressing changes, fumigation of and emotional care. He even described Vranita Agar, a dedicated post-operative recovery ward or post-operative room akin to modern surgical ICUs. Next slide, please, ma'am. Anatomy was a sacred, and Sushruta's protocol involved preserving cadavers in the river and herbs with the help of herbs, mud and herbs. It was the Sushruta's beliefs that the surgery for surgeon anatomy is the must. Dissecting layer by layer techniques were used at the time by immersing the dead bodies in the river. Studying the muscles, nerves, vessels in isolation, he believed that no surgery was safe unless the body's architecture was deeply understood. This foresight remains the cornerstones of surgical education today. Next slide, please, ma'am. Even in obstetric and gynecology, Sushruta was not behind. He described the obstructed labor, management of obstructed labor, internal rotation, cesarean section procedures, retained placenta, and uterine pathologies through primitive-like instruments. His approach reflected profound anatomical and physiological understanding related to the gynecology and obstetrics. Next slide, please, ma'am. One of the most first and most recorded cataract removal is credited to the Sushruta. His technique couching involved the displacing the opaque lens with steady force. He detained the types of the cataracts, instruments used, and postoperative care, and making this one of the most sophisticated procedure at that time. Cataract. Next slide, please. There are a number of contributions such as dosh. These are only I have described related to the surgery. Next, the final reflection: trees without roots fall over. So Sushruta rooted his science in the compensation, ethics, and curiosity. He believed in the healing of touch, not just a technical incision, from the plastic surgery to wound care, from anatomical precisions to biosurgical wonders. His contributions defy time. Thank you. Next slide, please. Thank you for walking with me through his timeless legacy. Let us carry forward the Shishruta's time, not just operating rooms, but in the hearts and minds of every healer. And I am extremely sorry for the technical, because the slides are sometimes mismatching. I'm just reading from here the slides, and sometimes I apologize for the technical errors. If you have any query, and you can ask. This is little bit more than theoretical lecture.
Sir, there is one query.
Yes.
Display maggot slideshow. Okay, okay. We will share the PPT, sir.
जी सर, आप शेयर कर दीजिए सर सबके साथ.
Yes, yes, sir. And
वैसे वो अर्बुद चिकित्सा में, कपच अर्बुद चिकित्सा में है सर, उसके ट्रीटमेंट चिकित्सा स्थान में है कि उसमें पहले अगर अर्बुद का कुछ पार्ट बचा हो तो उसमें मैगट्स प्रोड्यूस करिए, निष्पाव वगैरह डाल के, फिर वो मैगट्स उसको अर्बुद को बचे हुए पार्ट को खा लेंगे. ऐसे विविडली डिस्क्रिप्शन है मैगट थेरेपी का.
yes, sir. Regarding flap therapy, short.
फ्लैप थेरेपी सर.
Yes, sir.
प्लास्टिक सर्जरी सर.
Yes, yes, sir. That's
सर
your pylorhinal sinus. The work you are doing on that.
सर बेसिकली यहाँ पे हम सर फ्री फ्लैप्स मीन स्किन एक जगह से लेके फ्री, जिसका हमें जरूरत नहीं है, टिश्यू ट्रांसफर फ्लैप्स हमारे यहाँ पे सर ये सब करते हैं. पाइलोनोडल साइनस करें हम, लिम्बर फ्लैप्स करते हैं, और वुंड हीलिंग के लिए जब हीलिंग स्टेज में आ जाता है फ्री ग्राफ्ट हम प्लान करते हैं. प्लस हम स्ट्रिक्चर, एनल स्ट्रिक्चर के लिए जो सुश्रुता का प्रिंसिपल है, जैसे फ्लैप, रोटेशन फ्लैप हम इसमें यूज करते हैं सर. फिर प्लस टिश्यू फ्री करना है एडजस्टेंट टिश्यू से, पैरेलल इंसिजर, काउंटर इंसिजन लेके उसको फ्लैप को क्लोजर करने के लिए, वुंड क्लोजर के जितने मेथड्स है सर, जनरली सभी लोग प्रैक्टिस करते हैं सर. सर्जरी करते हैं तो ये सिर्फ फंडामेंटल्स है सर, और उससे सब लोग इंक्लूडिंग मॉडर्न सर्जन इसको प्रैक्टिस करते हैं सर.
सर
सर मेरा एक सवाल था.
जी सर.
अभी सर्जरी में अपन इतने एडवांस है कि और रहेंगे भी.
जी सर.
लेकिन एनेस्थेसिया में आयुर्वेद क्यों पीछे?
सर प्रैक्टिकली देखिए
के लिए
सर, आपकी आवाज नहीं आ रही है सर. जी सर.
सर प्लीज कंटिन्यू सर. वही मेरा क्वेश्चन था, हम एनेस्थेसिया में
एनेस्थेसिया रिलेटेड सर आपका क्वेश्चन है कि एनेस्थेसिया में हम इतने पीछे क्यों हैं सर. मैंने जो अभी सर जो जितना सर मैंने अभी जस्ट मैंने सुश्रुत संहिता में एट दैट टाइम वो हमसे कितना एडवांस थे इसके बारे में मैंने सिर्फ डिस्क्राइब किया है कि सर हाँ, आजकल का सर्जरी का कोई ऐसा बेसिक फंडामेंटल प्रिंसिपल्स नहीं है जो सुश्रुत संविधा में हमें नहीं मिलेगा। लेकिन रियली एट दैट टाइम सर एनेस्थेसिया सही में अवेलेबल नहीं होगा। बस हमें विविध जो कंसेप्ट्स मिलता है कि पेन मैनेजमेंट के लिए कैसे हम उसको थोड़ा सा रिड्यूस कर सकते हैं, इतना ही एट प्रेजेंट उस समय पे था सर। लेकिन ये हम लोगों के या हमारे फ्रेटर्निटी की थोड़ा सा लैक्यूना है कि हम उसको और डेवलप नहीं कर पाए। सुश्रुत के बाद दूसरा कोई हो नहीं पाया सर। दैट्स वाई कि हम कहते हैं कि उनको फादर है।
बिल्कुल, थैंक यू सर। सर और एक मेरा ऐसा सवाल था,
जी सर।
जब कैटरेक्ट की बात आई है
जी सर।
तो आचार्य सुश्रुत ने दैवीकृत बिंदु के बारे में कुछ बताया था
सर मैं
कैटरेक्ट
शालाक्य का एक्सपर्ट
के
नहीं
लिए।
हूं सर। सर मैं शालाक्य का एक्सपर्ट नहीं हूं। ये
सर
जो कैटरैक्ट का सर है, हम लोग उनको बाद में रिकॉग्नाइज किए। ये मॉडर्न वालों ने उनको पहले रिकॉग्नाइज किया कि फर्स्ट सुश्रुता वाज द पायनियर इन कैटरैक्ट सर्जरी।
बिल्कुल 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 सर।
ये
ओके,
मैं तो
थैंक यू
रेफरेंसेस सर सिर्फ ऐड किया हूं कि वो लोग इनको ऑलरेडी रिकॉग्नाइज कर चुके हैं इन उनके वर्क को।
सर। जय गुरुदेव। सही में आज का जो शेरखानी सर का लेक्चर था, जस्ट अभी आचार्य सुश्रुत जयंती हो चुकी है, कुछ दिनों बाद आचार्य चरक जयंती आने वाली है। इन दोनों के बीच में जो आज का सर का इतना अच्छा इंफॉर्मेटिव जो सेशन था, इसमें हम मेरे बुद्धि में तो भी फिशोबायोप्सी का उगम करने वाला जो हमारा बॉस आचार्य सुश्रुत थे, ये आज मुझे पता चला। सही में सर, और जो आयुर्वेद इतिहास में बताया गया है कि इंद्र की जो सर्जरी हुई थी, जो उसके वृषण की, जो कि उसके वृषण वहां पे, उसके अलावा जब उसके आंखों की भी सर्जरी हुई थी, अश्विनी कुमार ने जो किया है वो इतिहास में बताया है। मेरे मेरे को इतना कुछ पता नहीं फिर भी। और उस टाइम एक आयुर्वेद इतिहास में ये भी बताया है कि वह जब युद्ध में ब्रेन पे जब मार लगी थी, तब वो उसका सिर काट कर वहां पे अश्व का सिर लगाकर उसकी ब्रेन की सर्जरी करके वापस वो अश्व का सिर निकाल के फिर से वही सिर वहां पे रीयूनाइन किया था। यह सर्जरी में ये जो इतिहास बताया है, ये इतिहास पे आज का सर का जो लेक्चर हमने सबने देखा है, इस पर से और दृढ़ विश्वास होता है कि सही में उस वक्त आयुर्वेद या फिर आयुर्वेद का जनक आचार्य सुश्रुत, इन्होंने बहुत ही सूक्ष्म, जैसा सर ने बताया कि इंस्ट्रूमेंट के लिए कौन सा धातु यूज करना चाहिए, इतना सूक्ष्म विचार आचार्य सुश्रुत ने वो टाइम किया था। उसी के जैसा एनास्थेसिया के लिए मध्य के बारे में जो सर ने बताया है, ऐसा ही मैंने एक कहीं तो भी सुना है, मानस मित्र गुटी का भी एनास्थेसिया के लिए यूज की जाती है। इसी के अलावा बहुत सी कुछ जो जानकारियां प्लास्टिक सर्जरी वगैरह सर ने दी है, सही में मैं सर का तहे दिल से आभारी हूँ। और एक मैं यहाँ पे अनाउंस करना चाहता हूँ, वैद्य अपना वैश्विक गुरुकुल की तरफ से हर साल अभी स्त्री वैद्यों के लिए एक नया रणरागिनी पुरस्कार अ, हम देते हैं। इस वर्ष ही यह संकल्पना यानी हमने मूर्त स्वरूप में लाई। पहला पुरस्कार हमने वैद्य अनीता भरत कुमार जी जादव, इनको अनाउंस किया और हमारे गुरुवर्य प्रवीण जोशी सर के हाथ से दिया। अभी आने वाले चरक जयंती के दिन हम अगला पुरस्कार वैद्य हमारे ही बहुत जालना के, अभी जिन्होंने अपने ये वेबिनार में जिन्होंने एस्ट्रोलॉजी पर बहुत अच्छा सेशन उनका था, तो इस वक्त का दूसरा जो पुरस्कार है वैद्य सौ मीनल ठोसर मैडम को सभी आयुर्वेद हमारी वैश्विक गुरुकुल की पुरस्कार समिति ने ठहराया है, वह देने जा रहे हैं। यही मेरे को एक इंफॉर्मेशन सभी को देना था। धन्यवाद। जय गुरुदेव।